Good evening, judges. The vitek 2 device is an automated photometric system which is used for the identification and antimicrobial susceptibility testing. This instrument reads the kinetics of the growth every 15 minutes using an optical system which combines photometer and multi-channel fluorimeter readings to assess the fluorescence, turbidity, and the colorimetric signals. It is based on the minimal inhibitory concentration, which is the lowest concentration of an antibiotic that prevents visible growth of an organism. A culture of at least 24 to 48 hours old pure culture of the microorganism is used, and it is dispensed into 3 ml of suspension solution into the disposable plastic tubes provided by the manufacturer. The emulsification of 1 or 2 colonies of the organism is done in the suspension solution using a sterile inoculation loop. The turbidity of the suspension is checked with the help of a densitometer. The optical density should be in the range 0.5 to 0.63. A repeat inoculum preparation is done if the optical density is out of range. The card with the blue strip is the identification card, and one with the grey strip is the antibiotic sensitivity testing card. For a gram-positive bacteria, a gram-positive vitek card is used, and 145 microliter of the suspension is used to transfer into the AST tube. For a gram negative card is used, and 280 microliter of the suspension is transferred to the AST tube. The cassette is now ready to be placed in the vitek 2 machine, and it takes around 6 to 12 hours for the whole identification and the AST. These are based on the CLSI standards, which gets updated after a change in the breakpoint, and also the same gets updated in the database. It is faster than the conventional methods that almost take 24 to 48 hours for the AST. It is also simple and saves technical time with rapid accurate results and provide a permanent documentation. It promises to have a broad applicability for bacteria, anaerobes, yeast, fungi, and with the continuous expanding database also promises to have a remote access reporting in future.
This technology which is available that you used, or you developed it?
No, sir. It is available in other microbiological lab, but this is the thing that has been using for ophthalmological use also. The antibiotic sensitivity that they give on a general platform. Many of the antibiotics are not actually available for the ophthalmic use, and the formulations are not mentioned. So it is a generalized antibiotic sensitivity pattern in against the organisms from our body.
How is that different from ophthalmic use?
Ji, sir?
How is that different from ophthalmic, or what is the different that you did, basically?
Sir, the difference is the time. So it is so rapid that it can give you the result in just 6 to 12 hours.
That's true for ophthalmic as well as non-ophthalmic. So
Yes.
what is specific about ophthalmic use of this technology?
Sir, in cases of
Which you invented?
So I haven't invented, but we are using it in our practice. Like in the cornea department, the microbiological cultures that we send, the gram coage or the blood culture, chocolate agar, we incubate it overnight, and then we take the culture and we use it for the sensitivity pattern. It gives the result in just 6 hours, and within the same day or two, we can give
There's that technology which is available.
Yes, sir.
What is your contribution in this? Is there any? I'm just trying to assess that.
Yes.
Yeah. Is
So,
there any?
so my contribution is, it's not there, but we are using it for the early assessment of a disease.
So you're demonstrating.
So
you're
yes.
demonstrating technology.
Yes, sir.
How that
Yes,
can
sir. And
be-
how we are using
can
it
be
for
better used
earlier
for
demonstration.
ophthalmology. Yeah.
Compared to the Kribibor method, the disk diffusion method, it takes around 2 to 4 days. So we are diagnosing
Yeah,
it
we get your
within
point.
6
Thank
days.
you.
Okay, and is the the AST that it does it have the sensitivity to say moxifloxacin? Because
Yes, sir.
the other
Moxi-
ones don't have it.
They give the sensitivity pattern against the moxie, but they cannot say whether the topical or the ointment form, but they give the sensitivity pattern against moxie, sir.
Okay, so basically ophthalmic specific
Specific it is.
antibiotics, this is going to give you the results against ophthalmology specific antibiotics also.
Yes, sir. Yes, sir.
So you have added those antibiotics yourself, or they come?
No, sir. They come with the system itself, and there are around 14-15 antibiotics. And when they develop another new antibiotics also, they are also included in the system, in the database, sir. It is yearly updated, sir.